Welcome, everybody. My name's Anthony Brown. I'm the Chair of Global Action on Men's Health, and I'd like to welcome you to this joint webinar between Global Action on Men's Health and the International Journal of Men's Social and Community Health to talk about men's health policy around the world. This has been a topic that has been of interest for a lot of people for a long time, so we're very, very grateful to everybody for joining us today, and we're really excited that we're able to facilitate this discussion. This is very exciting for us. We have almost 100 people from around the world registered for this session, and we're really, really excited to present this to you today. So up on the screen now, you'll be able to see the program and the people who are speaking. I won't go through that. I'll let people read that, and as we go through, all of our wonderful speakers will talk from a different perspective as we move from the international case through to the regional, national, down to local policy, and then discussions on other ways that men's health policy can be included in health policy. So Peter, could you go on to the next slide, please? So our plan is that the webinar will last for about 90 minutes. I'd ask everybody to please stay muted unless you're invited to speak. As I said, we've got nearly 100 people who'll be joining us today. And we ask also if you could switch your video off. With so many people, we won't be able to take questions verbally, but we encourage you to please use the chat function. Please use the chat function to ask questions, but also as an opportunity for another forum and discussions and comments about what's being raised. And we also ask people if people are aware of other policies or aware of publications or things that you'd like to let us know about, or like others on the discussion to know about. Again, please use the chat function to do that. We will be recording this session. We are recording this session, and we'll publish a recording of this on our YouTube channel. We will keep a copy of the chat, but that's only for our internal use. That won't be published. So, so if we go on to the next slide, please, Peter. For people who aren't familiar with Global Action on Men's Health, we launched in 2014 and became a UK-based international charity in 2019. We're formed from about 50 organisations and individual members, and we're a network of individuals and organisations who are interested in men's health and want to progress the cause of men's health. And our mission is to create a world where all men and boys have the opportunity to achieve the best possible health and well-being wherever they live, whatever their backgrounds. And our main goal at the moment is to influence policy at a global and national level. And this webinar today is part of the way that we're furthering those discussions, particularly on a global level. So the next slide, please, Peter. So I'd like to now introduce Professor Steve Robinson, who's the Editor-in-Chief of the International Journal of Men's Social and Community Health, and our other partner in today's webinar. So over to you, Steve.
Thanks, Anthony. Yeah, so I just wanted to take a short while to introduce the journal to those of you that may not be familiar with it. So the journal launched in 2018, and we were very pleased last year to become the official journal of Global Action, which we see as a real positive step forward. The team at Dugmar Press, especially John Birkby, has worked really hard to get the journal indexed in Scopus and in DOAJ. And the plan is, if all goes well, for Dugmar Press to apply to the Science Citation Index at the end of this coming year, or more likely 2022. So the journal takes a range of papers on a range of topics. So we're interested in any types of papers, reviews, empirical pieces, opinion pieces, applied pieces, service evaluation pieces, anything that's to do with any aspect of men's health. We steer clear of issues that are too biomedical, hence the title of the journal being Social and Community Health. But that doesn't mean that we don't take pieces that cover men's experience of ill health, for example. We're very open to being approached. If people have got a paper but they're unsure of whether the journal would take it, then please do get in touch. We're quite interested in innovative pieces. The guidelines on the website are pretty clear, but sometimes people have additional questions that they want to ask. So feel free to drop me a line, and will be very quick usually in responding and answering any questions. Yeah, so I think that's it. My slot is very short today, so I shall hand back to Anthony.
Thank you so much, Steve. And as we said, we're so glad to have the journal, not just as a partner in today's webinar, but as the official journal of Global Action on Men's Health. Thanks so much, Steve, also for keeping to time. Hopefully you're a role model for our speakers who are coming up. What I would again remind people that to please use the chat function for questions. We'll be saving all of our questions till the end of the presentations. So as a question occurs to you while somebody's speaking, please put it in the chat function. We will be taking notes of it and get back and ask it. And so, we won't be taking questions at the end of each presentation. We'll do questions and discussions at the very end. So now I'd actually like to hand over to Peter Baker. Peter is the director, the executive director of Global Action on Men's Health. It's Peter's hard work that keeps Global Action going, and he's been the driving force in organising the webinar today. So thank you, Peter. I just want to acknowledge Peter for all of his hard work behind the scenes. Global Action wouldn't exist and wouldn't be doing the things that we're doing without Peter. Peter's going to give us an introduction to the case for men's health policies and barriers and opportunities around getting men's health policies up and established. So over to you, Peter. Thank you.
Yeah, thanks very much, Anthony, and hello, everybody. It's fantastic to see so many people here from all around the world. So you're very welcome, and I'm really pleased to be able to do this short presentation for you this evening, or this evening my time. What I'm going to do is really set the scene for the rest of the speakers by talking about some of the issues that are currently going on in men's health policy at the mainly at the international level, but also the national and the local level. The problem we're facing in men's health, and I'm sure I don't need to tell most of you this, is that the issue has been historically neglected, despite men's very obvious poor health outcomes. Men's health really has been a problem hiding in plain sight for far too long. And men have been largely absent from health policy at all levels, the global, national and local. Of course, COVID-19 has had a major impact on men's health, and data was published today which looked at 29 countries and found that in many of them, men's life expectancy had declined by over 1 year in the past year. So we know that COVID has had a major impact on men's health, but what it's also done is reveal really the long-standing problems in men's health, the underlying health problems that have affected men for many years, but have had an acute effect really during the COVID pandemic. And I'm talking here about problems like hypertension, diabetes, lung disease, cancer, the problems that we're all very familiar with. And if we're going to turn this around, we need to think about how we can get men's health much more integrated into health policy. Of course, there has been some progress. It would be foolish to deny that we have seen some improvements over the past few years. The WHO Europe, the European region, now has a men's health strategy, and Alan's going to be talking about that shortly. PAHO, the WHO region for the Americas, published a major report on masculinities in health in 2019, and we're hopeful that that will lead to further action in that region on men's health. And the WHO globally, in its publications on World Health Statistics 2019 and its report on universal health coverage again in 2019, really highlighted the need for a gendered approach to health that includes men. So it was moving away really from the traditional idea that gender is just about women's health, and talked about developing a new approach which embraced men as well. And of course, we have seen significant progress in a few countries with the development of national men's health policies. And we now know of 7 countries where there are national policies. Australia, which has had 2, and John will be talking about that shortly. Brazil, Iran, and we think the policy there was finalised and published in 2014. Ireland has had 2 policies, Malaysia, Mongolia, and last year in South Africa. So again, in some countries at the national level, we have seen progress. And we've also seen progress at the local level. Philippe will be talking about the policy in Quebec shortly. Several Australian states have published their own men's health policies, which sit beneath the national policy. And we've also seen some progress in the state of Tennessee in the USA, and also in Leeds in the UK. And also we have seen men's health reflected or included in the development of policies around particular health issues, such as gender-neutral HPV vaccination, which now takes place in over 40 countries, men's use of HIV services, and that was highlighted in the UN AIDS report's blind spot, and also the suicide prevention strategy for England contains an explicit reference, well, it runs through it really, it explicitly addresses men's greater risk of suicide and what can be done about that. So we have seen in some areas men's health included in policy, and Svendo is going to talk later about what's happened in Denmark with fathers' mental health. But generally speaking, men's health remains absent from policies and programs at all levels. And these, I think, are some of the barriers that are inhibiting action. Gender is still not a priority for many global health organizations, and there is still an assumption that gender is synonymous with women. Policymakers haven't engaged, generally speaking, with men's health issues. And I think that's partly because many policymakers in health come from medical backgrounds, and gender and men's health is not part of professional training in that area. But of course, also politicians don't ask policymakers to develop policy on men's health because they're not being pressured, or there's no pressure on politicians to take this issue particularly seriously. And of course, men are often seen as an homogenous and privileged group. So the men who are perhaps more marginalized in vulnerable groups and at particular risk of health problems aren't identified readily, and action is not taken to support them. And there has been, generally speaking, a lack of a common advocacy agenda by men's health organizations around the world. But nevertheless, I think there are opportunities for progress. Gender is rising up the global health agenda, and I've given some indication of, for example, how it's beginning to become part of WHO's thinking at the moment. We have an existing men's health policy platform to build on, the work that's been done internationally and nationally and locally. We have increasing evidence of the cost effectiveness of improving men's health. The Sustainable Development Goals, particularly those that deal with non-communicable diseases, I think have focused attention on the need to improve men's health. It's very difficult to see how the targets on NCDs can be met without addressing men's health as well as women's health. And of course, COVID-19, because of its disproportionate impact on male mortality, has, I think, helped to focus new attention on the issue. And then we have the evidence of the impact of men's health interventions. We actually know now what works. We have a much better understanding than we did 5, 10 or 20 years ago about what about the impact that effective men's health work can have. And here I want to mention our new report, Delivering Men's Health, which is published today. And you can now access it on the Global Action website, and the link is there on the screen. What that sets out really is it's a guide for policymakers and service providers who may not know much about men's health at the moment, but it's a guide to help them develop work in this area. So please help us to disseminate it as widely as possible. And the guide is accompanied by a database which we've produced, and I'm very grateful to them. We've produced this with the assistance of our colleagues at MENGAGE, at the Men's Health Information and Resource Centre at the University of Western Sydney. And you can see, using the link there, the new database that is now online. And that's very much a work in progress. So if you're aware of any evidence that could be included in that that's not currently on there, please let us know, and we'll be happy to add it to the database. So our policy goals, to finish off as global action, we want to see men's health policies introduced at all levels, internationally, nationally and locally. We want to see the development of gender and health policies that include men, and we'd like to see men's health included in all appropriate policies to help create system-wide services, programs and projects that engage men in health and improve their outcomes. So I'll stop there. Thanks very much indeed.
That's fantastic. Thank you so much, Peter. And we're so excited about the partnership with MENGAGE and the Men's Health Information Resource Centre. And I suppose in the spirit of full disclosure, I have to say that I'm an adjunct fellow at the Men's Health Information Resource Centre. And it's a partnership that we hope will help inform policymakers and other people working with men's health about policy and other men's health initiatives that are happening. The details that Peter showed in the slides are also in the chat. And I'd like to thank everyone in the chat who's using it as an opportunity to introduce themselves. If you haven't introduced yourself, please use the chat to do so. And just to remind people there's an opportunity to share information and to ask any questions. I'd now like to invite our next speaker, Emeritus Professor Alan White, to talk to us about the European Men's Health Strategy. Many of you will know that Alan has a distinction of, to our knowledge, being the first person to hold the title of Professor of Men's Health in the world. So it's wonderful that you're able to join us, Alan, and invite Alan, please, to give us some background and tell us about the European Men's Health Strategy. So thank you, Alan.
Thank you very much. And it's excellent to be able to join you today. Can I have the next slide, please? And the next slide, please. In 2011, we were so excited when the European Commission commissioned us to do this Data Men's Health in Europe report. And it's great that Svendor Medicine is on the call, because he was with us as we went on that journey. And that was a momentous opportunity for us to say to the European Commission, men's health exists, and they had have to take notice of it. And one of the things that stood out from that report was the huge numbers of men that were dying prematurely across the board. It wasn't just in one area. And I think that's what surprised a lot of people, that it was every area of men's lives could be seen to be affected by either their biological sex or their gender. Can I have the next slide, please? And that actually led us to have a BMJ editorial saying that we needed our own health strategy. And it was met with a resounding silence. 2011, that came out and nothing happened. But it existed, and I think that's an important feature of a lot of men's health stuff, with moving in a direction and moving in a journey. If I can have the next slide, please, Peter. In 2016, the Regional Office for Europe brought out a women's health report, and this was actually a great step forward, I felt, because it sort of opened the door for a men's health report, because I knew that the people in that gender unit wanted to look at men's health. But there was another period of silence after that. Can I have the next slide, Peter, please? But what they were building on was the 1995 Beijing Platform for Women. There was the 97 gender mainstreaming, but then there was the SDGs, the Sustainable Development Goals, which are significantly important in starting to get people to think about how how lives should be led within the European region, and the Health 2020, which was calling for gender equity. Next slide, please, Peter. Another report that came out was that towards a Europe free of avoidable, non-communicable diseases. Can I have the next slide, please, Peter? And this was looking at premature death. Now, when we're starting to look at premature death, this is where it starts to get very telling for men. And this is a graph of the difference in probability of dying between the age of 30 and 69 between the member states. And you see in some member states, there wasn't very much of a difference between the men and the women, but then it moved away. There was this moving away, and that triangle that was created. Can I have the next slide, please? Led them to call them the missing men. And the adverse mortality among working age men has a profound demographic, economic, and political impact on the region. So this was the World Health Organization saying explicitly they recognized that there was something going on here. And it's been observed for so long that it's considered natural and unmodifiable. And actually that's not the case. Next slide, please. And they stated it wasn't just biology, and it was constructs of maleness that are at heart of the excess mortality, and that we need to be starting to look at these and work out what could be done. Can I have the next slide, please? So when they pulled us together to help them formulate this report and the strategy, it was very interesting to see the scope of it. And this was something that I thought was extremely powerful, in that it was looking at not just the health aspects, but it was governance, it was economic policy, the health and social policy, environment, education, occupation. And it was also looking across the lifespan. And it was focusing around the SDG 3 for health and well-being, the SDG 5, achieving gender equality, and the SDG 10 on reducing inequalities across the life course, and with a masculinities base. So it had a very strong formulation that would help us to think it through. Could I have the next slide, please? And in 2018, we got the report. And this was significant in that it was ratified at the regional congress for the region, and there was 53 countries that signed up to it. And so we have now a statement, a report of the state of men's health across Europe, and we have a statement, a strategy, which says this is the way the World Health Organization should be dealing with this, but also all member states should be dealing with this. And it's going to be quite telling. I think the COVID has sort of set them off target, because by now there should have been some reporting back from the countries as to how they're getting on with it. If I could have the next slide, please, Peter. The objectives for the strategy were to reduce premature mortality among men due to non-communicable diseases and unintentional and intentional injuries, to improve health and well-being among men of all ages, while reducing inequalities between men and within countries of the region, and improving gender equality. I think they keep coming back to the gender equality, and I think this is a very powerful part of this, is that they're saying that we have to be seen as part of the gender equality debate. We have to be thinking about how we get men engaged in self-care, fatherhood, and care, violence prevention, sexual and reproductive health, but also around gender equity, about how we get a leveling out justice amongst the genders to make sure that we're all meeting the same objectives. Can I have the next slide, please? So the priorities and key areas for action were to strengthen the governance for the health and well-being of men. So this is a plea to go out to all the different nation states to say, and this is what we're going to be looking at as we go in this next part, to say, whatever you're doing, wherever area you're looking at, where are men? How visible are men within your policies? And we have to make gender equality a priority for men's health. We have to make health systems gender responsive, and we have to improve health promotion. We're not just giving out bland messages to the population, but thinking specifically, who is your audience? Market research to make sure that we're getting the right message to the right person in the right way. And we have to build on a strong evidence base, which is again leading hopefully to a policy base where we can get some more funding for men in these key areas. Could I have the next slide, please? So activity since 2018, it exists. It's the first official recognition, and it's created a backdrop for papers and activity, but I can't find any country that's officially responded to the strategy at this stage. Can I have the next slide, please? However, as Peter's already alluded to, the World Health Statistics has made explicit recommendations that we have to look at men as a specific case to see why we have got these issues. Gender analysis and health policies should consider women, men, and gender diverse population groups to ensure equitable health outcomes. Health planning needs to allow for different needs of men and women. Could I have the next slide, please? So the summary, the men's health strategy is focused on preventing premature death, reducing inequalities that exist between and within member states, and improving gender equality. The aim of the strategy is to inform action by member states in the region to improve men's health and well-being while promoting gender equality. However, I don't think there's been much in the way of impact of the strategy at the present. However, I think we are making progress. Thank you very much.
Fantastic. Thank you. Thank you so much, Alan, and for that overview of the work in Europe. I think there's some really important and key insights that you've offered us there that I think we can all consider. So thank you very much. Thanks also to people who are using the chat to share information about themselves and their work. And again, remind people that that's there, and invite people to ask questions and make comments for our speakers as we go along. I'd now like to invite Emeritus Professor John McDonald to talk to us about the Australian men's health policy. Professor McDonald is the Foundation Chair in Primary Healthcare at Western Sydney University, and he's also former Director of the Men's Health Information and Resource Centre. And the current Director of the Centre, Neil Hall's online, and he reminds us in the chat that Merck is soon going to be known as the Centre for Male Health. So that's an exciting and new development. So thank you for your time this morning. It's early in Australia, as the Australian colleagues on the line can contest. So thank you and welcome, John. You're on mute, John.
Hello, can everybody hear me?
Hello, we can.
Oh, so thank you very much, Anthony, and welcome to everybody. It's quite exciting to be in a Global Action for Men's Health webinar. As I see, we're becoming more and more global. So if I'm allowed to say, I'm happy to see colleagues like Margarita and Paola from Chile, and people from what we would call the South, and here from Australia, which someone has called the island off the coast of Asia. I'm hoping that we will expand also in that direction as well, and we'd like to be involved in that. So, well, hello to everybody. And I want to say, like we always say in Australia, an acknowledgement that in this country full of contradictions, like we all are, that in Australia we have to acknowledge, and I do acknowledge, the situation and the history of our Aboriginal people, the Indigenous people of this country, who were here long before us and who are still here, but who suffer poorer health than the rest of us. I acknowledge that. I also want to say from the beginning that this is a purely personal view, so please don't blame my colleague Neil Hall or Anthony or anybody else or the government of Australia for these views. These are my personal views. and I take responsibility for them, but don't blame anybody else for them, please. So, okay, could I have the next slide, please? This is a caveat. I was, of course, a consultant to the 2010 policy, and I am and have been an advocate for the social determinants of people's health. Next slide, please. The title of the 2010 policy, I think, is significant. It's called Building on the Strengths of Australian Males. So we have a focus there on the health and factors outside of men. And thanks to Alan, we've seen the World Health Organization is talking about its development goals, which are clearly health related, but not focused only on medicine. Okay, could I have the next slide, please? That's a picture from the 2010 policy, and maybe you can see the title, Building on the Strengths of Australian Males, which is clearly different from focusing just on the diseases and life expectancy. Okay, next slide, please. This is the new strategy we have. Notice it's called a strategy, 2020 to 2030. And you will see from my presentation that I see that this is a move away from the social determinants back to a more medical and disease-focused orientation. Next slide, please. This is kind of obvious. Both policy documents, 2010 and 20, give facts and figures of diseases, and you can find them on the web by Googling both policies, including life expectancy, suicide rates. Of course, it has to be said, and both documents do, that Aboriginal people are suffering poorer health than non-Indigenous people, and that both documents admit that 80% of suicides are consistently of men. Next slide, please. Now, sorry, it's a bit big, but this is the center of what I want to say to you. All health policies are influenced by the way in which health is seen by those of the power to implement action and to spend money on solutions. And health can be seen either as largely influenced by the environments in which we live, the physical, economic, cultural, emotional, etc., what we would call the social determinants for health, or health can be seen as those efforts to address a series of diseases with an emphasis on personal responsibility for lifestyle choices and behavior, including attendance at medical services, more clinical and more medical approach. And in either case, the final shape and direction of what happens gets rolled out in medical and health service bureaucracies of the country in question. What I'm contending in this presentation is that the tension between these two views is reflected in our two policies. Please, next slide. Okay, excuse the length of this one, but let's say Australia is a prosperous country. Average life expectancy is around 80 years for men and women, except of course for Aboriginal people. The poorer life expectancy of men can either be attributed to men's lifestyle and individual choices coming from masculinity, or alternatively to people's contexts like nature of the work, socioeconomic situation, what we would call the social determinants. Of course, it could be a combination of both these factors. I want to acknowledge the Australian women's health policy and the women's studies, which take account of the social determinants of women's health. There is a vibrant women's health movement in Australia. There are significant discrepancies in the country in terms of illness and life expectancy. And as I say, Indigenous people suffer more than the rest of us. Next slide, please. Now, for me, I want to say, this is a quotation from a woman called West, writing in 2010. I think it's worth looking at. This is about public policy in general. Emphasis in health policy has shifted from what? From curative intervention to prevention and health promotion through personal responsibility for lifestyle choices, and most recently, to the social determinants of health. These shifts draw attention to and legitimize women's health research that moves beyond biomedical, epidemiological, and subjective knowledge to question previously unquestioned societal norms and structures that influence women's health. Absolutely. I'm sorry that this is not reflected in most men's health policies, and not yet in Australia either. Next slide, please. A study of men's health was promised in the 2010 document. It was to have an emphasis on the social determinants of health. This would have involved consideration of socioeconomic status. Wow. The effect of unemployment, rent stress, and the like. Data on these things perhaps is difficult to include. So instead, we have a study focused on behavior and individual responsibility. That study in Australia, which we pushed hard for, is called the 10 to Men study. And I sad to say it's not focused on the social determinants. Next slide, please. This is my conclusion. Neither of our documents, 2010 nor 2020, is perfect, but both are worth reflecting on. Briefly, the 2010 male health policy had more of an opening to the social determinants of health, external factors. And the 2020 men's health strategy is more disease focused. This is a quote from the woman I've quoted already about the directions of public health. It's more curative intervention rather than prevention and health promotion through personal responsibility and lifestyle choices, rather than focusing on the context, which can influence our health, which is kind of obvious here in Australia. And as you may guess, I'm originally from Glasgow. And it's interesting that the 2008, the Commission on the Social Determinants of Health mentions two people from Glasgow, from where I come from in Scotland, where there's a difference of 27 years in life expectancy from one part of Glasgow to the other. And that surely cannot be attributed to something called masculinity or to lifestyle choices. It has to do with their social determinants. I want to say in conclusion, in the future, it remains to be seen whether we remain within the disease and personal responsibility focus or move towards a focus more on the social determinants of health and what can be done to make whatever country we're in a more health promoting environment. That's it. Thank you very much.
Thank you. No, thank you, John. Thank you, John. We really appreciate that. And I think that presentations highlighted one of the key tensions on the ground in policies between a biomedical approach and a social determinants of approach. And I can see that there's some questions and comments in the chat about that we'll return to during the questions and discussions at the end. Thank you. And I'd now like to welcome Professor Philippe Roy, Professor of Social Work at the University of Sherbrooke in Canada. And Philippe is going to talk to us about local policy and the development of the Quebec Men's Health and Wellbeing Action Plan. So welcome, Philippe.
Thank you. Merci beaucoup, Anthony. So I want to echo John McDonald's introduction, say that I am at the University of Sherbrooke, located on the land of the Abenaki First People. And I live on the territory of the Atikamekw First People. And I'm very grateful that I've been called to by a former student of Intervention with Men course. She's now in a remote First Nation community in Manga, and I'm invited to go there to run a workshop on men's health. So the wheel is spinning. It's really thrilling. And before I was appointed social work professor, I was at the regional public health office on the planning and implementation of the Men's Health Action Plan I'm going to talk about today. So thank you for the opportunity to Global Action for Men's Health. So the province of Quebec has implemented its own Men's Health Action Plan in 2017, becoming the first North American government to do so. French is the official language of the province, as you may notice so far, which results the few research papers and official documents are published in French, or translated in, few research are translated in English or other languages. So the province is often described as an exception in North America due to presence of progressive public policies, long-term parental leave for both mothers and fathers, state-supported daycare network. But the number of men's community organization is quite large compared to countries of similar size. Quebec is 8.5 million, which is close to maybe Sweden, I think. So the Fatherhood Association gathers 250 organization individual. There are almost 30 temporary housing for men and their children, called Maisons de Jeunes Network. There are 33 community organizations helping men with violent behaviors and various general community organizations providing generalist services for men. So over the past 3 decades, there's a growing acknowledgement of men's poor health along with concern for their help seeking and service use. Suicide was probably one of the most high profile issues, and men's suicide rose constantly between the 1980s until 2000. And then there's a steady decrease. It's more than 3 times Quebec's women's suicide and almost twice the rate of Canadian men for the same period. So in this decrease, the women's suicide was quite stable, small waves, and the decrease is greater in Quebec compared to Canada and United States. So much that the Quebec's National Institute of Public Health argued the focus of men to prevent suicide has been beneficial over recent years, but much work is needed ahead. So a recent survey points out that 2/3 of men prefer dealing alone with their problems, and 1/3 don't know which service to refer for psychological distress, a survey that was made with Quebec men in 2018. So what was the road traveled to reach a men's health policy? So around year 2000, suicide prevention campaign started to aim men specifically. It was the first step. 2004, the Quebec government initiated the Work Committee on Prevention and Health for Men. This committee outlined specific need for men regarding the health and the lack of services adapted to their reality. It had a major impact due to its evidence-based content. It was followed by a series of reports on specific topics. Then in 2017, the Men's Health Action Plan, just like the Women's Action Plan, lays on sex and gender analysis to improve social response to health needs of population groups. This plan was divided in 3 orientations. So the first one, improving health promotion targeting men. So each sub-region had to make a regional action plan based on local portrait with the following part: taking into account evidence-based knowledge on men and fathers to develop promotion and prevention activities, sensitize intervention, promotion, and prevention teams for efficient strategy to better reach men out, fathers and adolescent boys, to adapt tools used to collect data on men's issue, including fathers and intervention with them, and finally implement action targeting hard to reach group of men, such as young men, men in breakup situation, fathers in a context of vulnerability, and also Indigenous men living in urban areas, and many other groups. The second orientation is adapting health and social services to improve access and response to men's needs. So it's one thing to promote, it's the second thing to welcome men appropriately. So there's the second orientation is probably the largest part of the action plan, which consists of workshops for health and social service managers to sensitize the rationale for adapting services to men. Therefore, those managers are likely to support their team members on the first line to participate in the training intervention with men. This training is central. Each session lasts 14 hours over 2 days, gathers 12 to 15 professionals. It covers theoretical and empirical knowledge on masculine socialization and its impact on men's health seeking process. The second part presents an intervention model with men, completed with a toolkit for practice in specific contexts: bereavement, breakup, depression, aggressivity. And in these one, I love to play the role of the rude client. So the third one, improving knowledge through research. So the development of empirical research contribute to greater acknowledgement of diversity of masculinities, brings relevant knowledge to the frontline practice setting, and ultimately promotes gender equality. In each region, a poll member is designated in collaboration with the regional men's health and well-being respondent, facilitating synergy between research and practice. The poll I'm talking about is Pôle d'expertise et de recherche en santé bien-être des hommes, which I can translate by a research and expertise hub on men's health and well-being. So it's an action initiated by the Ministry of Health and Social Services. It gathers 40 researchers, 80 grad students. So please visit our website with research in French and English. So the key element is maybe a clear support to women's movement. Acknowledging and responding to men's issue do not mean accommodating unequal harmful practices. When those practices are targeted, a focus on positive practices and responsibility is needed to counter harmful elements. A strong connection, quantity and quality between community organization, practice, research, and policymakers. We can't stress this enough. Those links are essential. And consideration for men's strength and positive aspect of masculinities can be observed in various outcomes in Quebec. So health promotion campaigns, the influence of solution-oriented and salutogenic approaches in training for healthcare professional and research. And also attention to the living condition of subgroups of men and to diverse interaction patterns with health services. As we mentioned, men are not an homogeneous group. So we have to consider the diversity of men's realities. I will end with the challenges. So during COVID pandemic, we noticed a pause in government activities with men's health. It's sort of a backlash. The emergency of the situation was responded with a backlash to sort of a gender blind approach. This is kind of worrying. It gets better, I guess. Only few university courses cover men's health and well-being. That's a challenge because dissemination of knowledge in academia must be added to collective efforts to deploy by various parties. Finally, men themselves must continue to question gender norms, role, and relation, and engage in practices of masculinity that are aligned on health, social justice, and gender equality. So on the same alignment, gender health and social services and society at large are invited to question and improve their response to men's health issues. This is not at the expense of other gender issues, but rather in the spirit of solidarity to mend the gap for greater gender equality. Merci. Thank you.
Thank you so much, Philippe. That was such a wide-ranging presentation, and there's so many interesting things there that I think we'd like to sort of return to in the discussion. And I was particularly pleased to hear the term saltogenesis and what's health sustaining for men and some of the health creating aspects of masculinity that I fear in so many of our discussions we sometimes forget about. So thank you. I think they're really, really important initiatives and insights there. So I'd now like to welcome Dr. Svend Marston, who's the chair of the Men's Health Forum in Denmark. And Svend is going to be talking about the incorporation of men's health into other health policies, and particularly looking at Denmark's policy on fathers' mental health. So welcome, Svend. We're so glad you could join us today.
Thank you, and hi to everybody. I'm pleased. I'm pleased to tell you that just 2 weeks ago, actually, the Danish health authorities published a new guideline for giving birth and being parents in Denmark. And for the first time now, we have succeeded in getting them to say that just as many men as women do get perinatal depressions, as we call it, most of you probably call it postpartum or postnatal depressions, but as we know that it's something that starts also before the birth of the child, we call it now, the official word is perinatal depression. And here they state that it is 10% of all new fathers and around 10% of all new mothers, or mothers and fathers to be, that will suffer from a perinatal depression. That means that all the health system in Denmark now has to work to find and to treat and to help and to prevent this perinatal depression in all families, and for both men and women on an equal basis. So this is work from during something like 20 years or something like that, that we have succeeded just 2 weeks ago and have it as an official health policy in Denmark. At the same time, they state that we should, the municipalities and hospitals should screen both fathers and mothers for perinatal depressions. So have all, and that is a tremendous success for us actually. But I was asked to talk about how we got there and what could be done and learned from how to go there. Well, first of all, I think it's our research at our Copenhagen University Hospital. We started a men's Copenhagen University Hospital fatherhood research program in 1998, and it's still running. And from there, we have developed a lot of evidence about fathers and fathers' relations to their children, and also the mental health processes of being a father and the dynamics in that. And we have had around 7,000 fathers participating in all the different studies, which are fathers' attachments with their infants, mood disorders in men becoming fathers, psychotherapy with men with parental depressions, fathers and delivery, fathers and fertility treatment, and so all those kinds of studies we have made. And I think that's a solid basis for going to the politicians, which has been the next step when we have had all these research results. Actually, in 2002 was the first time that we mentioned and found out during our research that men could also get, at that time we called it postnatal depression. And that was actually a joke in all newspapers in Denmark, where they showed cartoons with men crying and doing a lot of things. And it was just so funny that somebody said that now men could also get perinatal depressions. But soon after that, hundreds and hundreds of fathers came to our hospital wanting to be treated for this, because when they heard that this is what is going on, they actually could see themselves. And that was a big step forward. And still then, hundreds and hundreds of men have been treated at our hospital and in all our private clinics and other clinics in the country for this suffering. So I think that's the first thing, is the research, and then showing that it actually is needed in real life. The next thing is that we went to a lot of politicians, talking to them about this, going to one-to-one talks with politicians from all parties in the parliament who has shown interested in this area. And then at the same time working together with different NGOs, also women's NGOs and mothers NGOs, who actually were very supporting our work in detecting fathers and helping fathers with perinatal depressions. So after a lot of those talks with the politicians, we began to get some money from the parliament and from the national health authorities and other institutions to go on with our research. And we have been researching that since then in many different ways. The next step, I think, or the step at the same time with the politicians, is to get out in the media. And the media are very hungry for this kind of stories that men can get perinatal depression, having case studies and case stories with fathers telling these stories about how they felt and how they came through their perinatal depressions, and in television programs and in radio programs, in newspapers, there's a lot of interest in that kind of story. So that helped us too. Next step again is that we have done a lot of teaching for nurses, for midwives, for GPs. I've just been in the Isle of Crete teaching GPs for a whole week on the men as a patient and fathers in their clinics, fathers to be in their clinics, about all these areas we're talking about today. And I think that it's very important to get relations and good relations to a lot of people in the organizations of doctors, of nurses, of midwives, and things like that. And actually, it has now been a mandatory study on the health nurses' education to be teach on men and perinatal depressions. So I think that is also building very much on how to get it on. A lot of teaching. We have built now a network of home nurses in Denmark, calling them father ambassadors, who are in 75% of all the municipalities in our country. And they are a big network which we meet with several times a year in regions and in the whole country, and the country as a whole, and talking about all these areas of men as fathers and men and perinatal depression. And I think that is a very solid background for doing this. And we just, the other day, actually, we published this book called Father for Life, which is a book about all the ways we can support men to be fathers. And the last thing I will say is that Men's Health Forum in Denmark is a partnership with more than 50 organizations as partners. The national health authorities, municipalities, patient organizations, medical pharma companies, and trade unions, and a lot of organizations coming together in saying that we want to do something good for men's health, and especially also for men as fathers. And in Denmark, the big discussion right now is about the new parental leave that shall be implemented here in the coming year. So that is a big discussion in Denmark, and we have a central role in that because of all our work on that. Thank you for the word.
That's wonderful. Thank you so much, Svendo, for those insights, and particularly not just about those insights around the work with fathers, but I think you've also spoken about some of the practical approaches that were used in terms of using research and talking to politicians, and the use of the media in bringing about change and bringing about really an appetite for men's health, and including men in policy. So thank you very much for that. I'd now like to introduce our final formal speaker, Professor Doris Bardell, who is the coordinator and on the scientific advisory board of the Men's Health Foundation in Germany. Now, Doris is also a board member for Global Action on Men's Health, and I need to acknowledge that actually this webinar today came out of a conversation that Doris started on the board when she asked about what was it that, how was it that different regions, countries had been able to get men's health policies, and this was something that Germany was working towards, or the Men's Health Foundation was working towards. And in those discussions, we thought that there were ideas coming up that would be of interest to many of our members. And so that discussion is what was the genesis of this webinar. So thank you, Doris, for that discussion and for getting that which brought us all together today. So again, I'd like to welcome Doris and thank you, and over to you, Doris.
Thank you very much for introducing me. Today, I would like to present the efforts for a men's health strategy in Germany, which has been going on for years and are still not crowned with success. I'm speaking as a staff of the Men's Health Foundation Berlin, which has been a driver for a men's health strategy in Germany from the beginning. The next slide, please. The next. The efforts for men's health became visible already in 2005. The foundation published 4 men's health reports, and the Robert Koch Institute, on behalf of the Ministry of Health, another men's health report. 2 of these reports have a general overview, one on men's mental health, one on male sexual health, and one on male health around retirement. Despite comprehensive recommendations for action in the reports, press conferences, and public relations, the only thing that has remained is the 5-year shorter life expectancy of men. A positive sign was a statement of the Federal Minister of Health at the Men's Health Conference last year in Berlin. Based on the WHO Europe strategy of 2018, a men's health strategy should be supported by the Ministry of Health. The next slide, please. What served as an aspiration for existing men's health strategies in these chronologically listed countries with acting men's health strategies or men's health action plans? The identification of men's health as a priority health goal played a dominant role around 2000 and subsequent years, supported by the formation of the International Society of Men's Health, the World Congresses of Men's Health, which started in Austria, the publication of academic journals of men's health, and the foundation and action of European Men's Health Forum. On average, it took 6 to 10 years between the analysis of men's health and the development of action plans and strategies. Only in Mongolia, where men's life expectancy is 10 years lower than women's, WHO had a major influence on strategy development. We now have this overview and can derive from it how a country should best proceed when developing a strategy. In Germany, the struggle for a men's health strategy has been going on for 16 years, but so far there is no optimistic target orientation. The next slide, please. There are currently 3 campaigns and a steady task underway to launch a men's health strategy. First, this is a manifesto to parties and government representatives under the motto, "It is time for a German men's health strategy." The second, the day of shortened life expectancy, December 10. And third, preparation of the Men's Health Week for next year. And fourth, the further development of national and international cooperation on men's health. The next slide, please. During last year, the 3 most active NGOs started to mobilize forces for a men's health strategy in a working group with 9 members. In April this year, A kick-off meeting was held with the participation of the Federal Ministry of Health, and further steps were discussed. This included contacting the Green Parliamentary Party in the Bundestag, the Federal Minister of Health, and drafting a manifesto for a men's health strategy, which is intended for the new government formation in the context of the Bundestag elections. The next slide, please. Now we look to this manifesto that consists of two parts. In the first part, facts about men's poor health are listed, and it is concluded that too little is being done in Germany to improve men's health. In the second part, the first steps toward a men's health strategy are listed, which require political support. Therefore, the manifesto primarily addresses the new federal government, which was elected yesterday, you know, I believe. We have just received support in the form of men's political demands for the Bundestag elections. These were prepared by the Federal Forum for Men and also includes a demand for national strategies for boys and men's health. The next slide, please. The Day of Unequal Life Expectancy demonstrates that men symbolically only live until December 10 each year, whereas women live until December 31. The mainly community-based activities start on November 19, International Men's Day, and end on December 10, Unequal Life Expectancy Day, with a central event and press conference. The focus this year will be on depression. Next slide, please. We have already started preparing the content of the Men's Health Week for next year. We want to place it under the motto Men Move, especially after the Corona lockdown and the associated weight gain of many boys and men. An orientation towards a healthy lifestyle and physical exercises should be given. The next slide, please. At our conference in April, we agreed to work more closely with all the institutions and people who are engaged for more attention to men's health. We have been able to strengthen international cooperation through the WHO European Strategy of 2018 on health and well-being of men, the organization of the International Men's Health Week, and our membership in the Global Action of Men's Health. This helps us to increase the pressure and the willingness in Germany for a national men's health strategy. And the last slide, please. We are a small NGO with self-financing. Therefore, our forces are limited, and we are orienting ourselves that the political leaders will take the lead for a men's health strategy. That's now our activities. Thank you for the attention.
That was wonderful. Thank you so much, Doris. And thank you so much to our speakers who have all kept to their 10 minutes. I didn't have to come in and with a heavy-handed timekeeper. Everybody was marvelous. So thank you all so much. Thanks also to everybody in the chat. The chat's been fantastic. Lots of discussions, lots of questions coming up there. One thing that I would add is that if people are aware of a men's health strategy or policy, whether it's at a national level or a very local level, or whether it's an example of a health policy that's been good at integrating men and boys' health into it. If we haven't mentioned it today, please let us know about it in the chat. Add a link to it if you know a link, because we will be putting a list together of the policies and where people can access them. So thank you for that. As I said, the questions have been coming in, and one of the, so we'll turn now to questions and answers, and please put more questions in the chat. I ask people to please keep your video off unless you're called upon, and we'll direct questions to our speakers as they come up. There's been a question, I think that this could be for all of our speakers. It's from Mark Brooks asking about the development of national policies and what political opposition or other opposition people have faced in the creation of those policies. So Professor McDonald, John McDonald, was talking about the Australian men's health policy. So John, I know we've had a policy here for a number of years, but I'm wondering if I can call on you to reflect on opposition, particularly early opposition around actually developing a men's health policy.
Thank you very much. And once again, Anthony and everybody, I'm speaking from my own personal and therefore limited experience. Yes, of course, there are obstacles in the way of developing men's health policies. And some of them are obvious, that they've been mentioned, that there has been a tendency to focus on women's health, understandably, unfortunately, often on women's reproductive health, which I'm glad women's movement is moving away from, to take a more broad view of women's health. But I don't think we've learned from that to take a broad view of men's health. I think the Me Too movement and the emphasis, the understandable and important emphasis on domestic violence and men as perpetrators, some men as perpetrators, has influenced the tone of the context in which policies are developed. And therefore, I think there is definitely in my own experience, there has been a definite political hesitancy to develop anything other than a focus on men's diseases, and even to include depression as a disease. And I think there's a lot, I'm glad to say, a lot of questioning around that and looking at the context of depression. Why are men depressed? And that leads us back to the social determinants of health. So yes, I think there are obstacles in the way of developing men's health policies, not if we focus only on disease, and not if we focus on depression and suicide as diseases, as pathologies. I think we can go ahead with that. But looking at wider, deeper issues, we run into problems with the general global context of gender policies. That's my own opinion. I don't know if that answers the question, but that's what I'm thinking.
Thank you, John. No, I think it definitely helps to reflect on the context and the political context and that we're in at the moment. So I think it is helpful. And actually, I'd like to ask Svendo to reflect on perhaps some of the obstacles in their work around the father's policy. I thought in your presentation, Svendo, you did a great job of talking about some of the things that you used to progress the policy with research and media stories and work with politicians. But initially, was there opposition that you met, and could you reflect on what some of that was?
Well, I think the opposition is more right now than it has been all through the years, because the opposition to our work right now is very much on the parental leave question, because we are going to have 2 months parental leave for fathers, and this is what women think will be taken away from them. We have 1 year parental leave, and most women has been using that through the years. Right now, we're going to have 2 of those months should only could be taken by the father. So that's the opposition right now, and that's a really heavy discussion in Denmark just these weeks actually. But during the years, I think that I mentioned it was a bit funny when we talked about that men could also get perinatal depressions, but that was not an opposition. I think it has been possible to open the eyes for people and say this is something new and something real and something we can see in practice. I feel that the hardest opposition to our work with fathers has been in the psychiatric and medical areas where they have a very old-fashioned way of looking at a mother with a perinatal depression. That's the only one who can get that, because she is delivering the baby and just having the baby in her body and things like that. Politicians has been very positive for the mental health work we have done in Denmark. Right now we have 3 left-wing parties who support us to be on the Financial Act, and 1 Liberal party and 1 Conservative party. They all support us in being financed by the government, actually, not for so much money, but at least they are supporting us, and we hope we can do that still. So I think it's not so much opposition as it is lack of knowledge and lack of interest, like Peter also started to say that a lot of people have not been interested in knowing about mental health, although we have had the data about it for years and years. Thank you.
No, thank you, Svendo. And Philippe, I wonder if you have any reflections about opposition with the local Quebecois.
In Quebec, there was, I would say, opposition, but reactions in 2004. So that was more than 15 years ago. And it was a reaction with mostly ideological arguments that was in opposition with evidence base. And this choice of men's health to focus on evidence is probably one of the main strengths, because it's not only looking at how men use services or not, but also look at the health portrait. So there you can see how it fits or not, and therefore you step away from ideological debates that could be sterile, pointless, just arguing ideologically. It's hard to get out of this. So in 2017, no, there was no noticeable opposition that was so strong, and now there's probably I say encouragement to continue forward with, and it comes with money. So that's something that Men's Health Action Plan, having the research poll is something that the government delivered $350,000 over 4 years. So yeah, there's some support and not so much opposition, I guess.
Thank you for those reflections, Philippe. I think that's useful and something we can consider. I'm just looking at some of the other questions that have come through, and some of the comments around the challenges that people have faced, which is quite interesting and reminds us that this is quite a political space we're working in with men's health. And there's a question and a reflection from Marguerite, one of the colleagues from Chile who's joining us, so welcome, around actually asking if continuing to think about men's or women's health in the way that we are is perhaps a restrictive and binary way of talking about gender and health, and a comment that perhaps this we're not looking at different forms of masculinity, femininity, and the experiences of non-binary people, and that in Chile, gender politics still doesn't consider men, and even less people who maybe identify with men but aren't born in a male body. And this conversation about masculinity and femininity in health is something, and other genders is something I think we're all thinking about. And I was wondering, this was a conversation that actually Peter and I were having the other day. And Peter, I was wondering, do you have any reflections on how we consider talking about gender and health that you'd like to share?
It's a really pertinent question, and I'm delighted that it's come up, but I'm not sure I have an answer to it at the moment. In fact, I'm passing the buck a little bit here, but I was talking to Alan White about this only this morning as well, because Alan is working or taking the lead with producing an editorial for the International Journal on Men's Social and Community Health, where he hopes to kind of raise a discussion about this very issue. So it is something that, you know, some of us are actively thinking about. I mean, I think the question is quite right in the sense that it would be more helpful in one way if we could talk about gender and health, because it would encompass everybody, and it would be far more inclusive than discussions about simply women's health and men's health. My worry, though, practically, is if we move now to just talking about gender and health, then what we now think about as men's health would somehow disappear. The kind of issues that we're trying to raise would have less attention just at a time when we're beginning to get them on the agenda. So I'm a little worried from a sort of, I suppose, a tactical point of view about moving to a position where we just talked about gender and health. And I'm not sure that women's health organizations will be comfortable with that either at this stage. Although having said that, Global Action on Men's Health has had some really interesting conversations with women in global health and other women's health organizations recently. And we jointly wrote an editorial that was published, well, it was a comment piece in the BMJ, which talked about the need for men's and women's health advocates to work together to try and raise the issues that affect all of us.
No, thank you, Peter. And I'm wondering, Alan, do you have any reflections you'd like to share on that?
Yes, yeah. We're trying to on the editorial, trying to think about how we now define men's health. What is it? Who are men, and what aspects of men are we considering important when we're trying to define health and social care? So I think it's going to be quite an interesting exercise to try and pull together the argument, not the definition, just the argumentation about how we go about now. I mean, Doris Bardell and her German colleagues did an exceptionally good job at pulling together a definition, but even that's now a while ago, and I'm just going to put the link up for that paper on the chat. But we need to still problematize men. We still need to think about what it is that men's health is. In Leeds, we've done a lot of work. It's a city that it's the third largest city in the UK, and we've done a big study on the state of men's health in the city. And I've also done a big study on the state of women's health. And one of the things that has really been brilliant is how the women's health groups and the men's health groups are working together to look and see what are the common areas, what are the areas of difference, how can we work together. And the city itself is working very hard to try and create a gender health agenda. Now everything, all social policy, all money that is spent within the city, anyone who's putting a bid in has to identify how this is going to impact differentially on men and women and trans. And we have to see this perhaps as a model where, yes, it's all coming together under one umbrella of gender, but it is still separate, so that we can still have those conversations to problematize women and women's health, and what do they need specifically, and what do we need to do for men's health specifically. And there was a question earlier on in the chat as well about gender equality. And I think that that is also something we need to come back to. I raised it a few times within my talk. And it did initially start out as a very strong driver for women. And we know all the way through women's push to have recognition of their place within society and place within health and the politics, etc. Equality was absolutely paramount, but it's also now been recognized there's gender equality issues that impact directly on men, and we have to be thinking more specifically about how they can be addressed. So we're part of an ongoing debate. And interestingly, just going back to the previous discussion about the political pressures against men's health within the countries, there was also just a political invisibility. When I was talking to the gender unit at the World Health Organization for Europe, she said no country is pushing for this men's health report. There is no one there's no opposition to it, but there's no one equally pushing for it. And I think that that's another thing that we've got to get, is working with politicians, working with our governments, so they get to the point where they're actually asking themselves, why are we not doing this? And then they start pushing as well.
No, thank you. Thank you for those reflections, Alan. And I think that point about pushing for men's health, for men's policies, for gender policy, something that's, as Alan said, I like that phrase around the gender agenda, and making sure that that's on, that people are looking at that. We have on this call, nearly 50 people who are interested in progressing that. So I'm hoping we can all become advocates or continue our advocacy work to help make that happen. And we wanted to keep very much to time, and we're coming up to 90 minutes now. So I did want to thank everybody for your participation today, particularly to thank all of our speakers, and thank everyone for really the wonderful conversations that have been going on in the chat and the questions that have come up there. I'm sorry that we haven't been able to get to everybody's questions, but that's always a reflection of an interesting webinar when people are interacting and having those great discussions on the chat. Global Action on Men's Health will be holding more webinars, and I think that discussion around what is men's health, what is the issues around gender and health and gender relations and health could well be a topic for a future webinar in its own right. Again, thank you everybody for your participation. Thank you particularly Peter for organising today. We're exactly on 90 minutes, so we'll end it here, and we hope that you'll join us again for the future webinars and discussions. And for people who aren't members on Global Action on Men's Health, I'd really encourage you to think about becoming members. It's through your support and the work of our members that we progress work like this and help to progress and develop and get men's health policies actually on the ground, both locally, nationally, regionally, and hopefully internationally. So next time we come together, let's hope we can point to some international work that's really included men's health, and maybe even some clear men's health strategy in international organizations. So thank you all, and goodbye for now.